Namaskara. I'm Dr. Sunita Rana Agarwal from Dr. Agarwal Hospital's Bangalore. I am an ophthalmologist and I practice genetic medicine. Under eye bags or puffy eyes, as we may call it, develops most often because of stress, no sleeping, a lot of other conditions. However, there can be also some medical conditions that can be associated with this. Here, simple remedies are enough for us. If you tackle the eye strain and the dryness in your eye, the puffiness of the eyes also goes down. Simple things that we can use are cold compress. This works very effectively for the puffy eyes. There are two reasons for eye bags. One, you have not hydrated yourself properly, and hydration can create the puffiness in your eyes. Second, sometimes we have a septum that separates our fat inside the eye from not coming into the front. Sometimes small herniations occur. These occur 1, 2, 3, 4. 4 spots where small holes can occur and the fat comes out. These are actually natural mechanisms that were developed for the eyeball. The eyeball itself is approximately 5 ml in volume, whereas the whole orbit, which protects the eyeball from any damage, is approximately 30 ml in volume. This whole space of the rest of it is made up with fat and muscles. Muscle forms less than 2% of that volume. So the most of it is fat, and we need that fat for cushioning of the eye. So if somebody bangs you, you get into an accident, anything, you've got some amount of cushioning. However, we have an orbital septum that connects from the bone to the lids and keeps the fat back. When the small holes occur, herniation of the fat comes out and we get this puffy eyes. When this baggy eyes comes in, this is generally not treatable with simple mechanisms like cold compress and eye strain and treating the dryness in the eye. We need to go a little more deeper on this. For this, we would like to go into some surgeries or laser-based blepharoplasties that can be used here. Many times migraines and all these kind of headaches that patients come up with also lead to this baggy eyes. There are certain other conditions which can also lead to this baggy eyes, but more often than not we would need to go in for some amount of surgery or Botox or injections, and here monoclonal antibodies also form a part. PRP, platelet rich plasma, forms a part, but what I've seen most often and very good is the DNA injections. Yes, we can. Fillers can be used, but this is only for the very early stages. What we need to do is to plug the orbital septum, push the fat back. We need to do a blepharoplasty, take away that fat that has come out. For that, we need to make a cut in the skin and remove that fat. This is blepharoplasty. However, we can also shift to certain other mechanisms like fillers, PRP, monoclonal antibodies, injections where we take 1 drop of blood, give it injections. This repairs the holes in the orbital septum. Very often, if we take alcohol, smoking, excessive working, that means screen time, and no sleep. Sleep is the biggest problem for bagginess of the eye. You need to have an 8 hours sleep. You need to switch off for 12 hours minimum. We spend so much of time doing everything else once we come home that we forget that sleep is that important. And once you come back into a sleeping pattern, then you'll understand diet, exercise, sleep, all very important to not let your eyes get baggy. Everything works. Here, the reason I'm giving you the ointment is to combat some amount of that ointment, which is night creams and all these serums. Everything is very useful, and they've done a lot of research in bringing them to you. Vitamin drops, vitamin serums, all that very important and very nice to use. However, a little bit more on the expensive side. So what we need is Vaseline. I can't give you a jar of Vaseline and tell you to go put it in your eye, but I can give you an ointment. Problem is that it has an antibiotic in it. These are not at all very expensive. All you need is not for it to go into the eye, only outside the eye, like a night cream. Before you go to sleep, just rub little ointment on your lash margins and all around your eyes, your bagginess of the eyes, your dark circles, everything will come down.